But let's move to our next conversation, which will be the relationship between COVID-19 and mental health. Let's speak with Dr. Gbonjubola Abiri, who is a consultant psychiatrist and medical director of Tranquil and Quest Behavioral Health Nigeria. Good morning, doctor. So good to have you talk to us. I need a personal advice because as we speak, I'm getting a bit too tired saying same thing over and over again. Every day I'm here talking about COVID-19. I'm here lamenting about Nigerians refusing to adhere to the lockdown. I'm here lamenting about the fact that most Nigerians don't even seem to understand the level, what we are dealing with. How can you advise me?
Well, so to be honest, your feelings are valid. There's nothing wrong with how you're feeling, especially, because this is everywhere. It's everywhere you turn. You look at the papers, it's in the news. You look at your phones, it's in the news. You look at your social media, it's all over in the news. So it's only normal that this is, a normal response that you're giving to the news that is visibly all around us. It's in the headlines now. It's all that we're talking about almost every day. So don't feel strange that, it's what you're talking about every day. It's what you need to speak about. You need to talk to Nigerians who appear not to believe that it's happening. You need to talk about social distancing, people, just staying at home and doing the simple hygiene guidelines that have been put out. So it's not unusual that you're feeling this way. It is only the normal response to feel that, well, it's all up in our face.
Earlier, we spoke to Isabella. Isabella is a survivor of the coronavirus. She was discharged sometime last week from the isolation centers. But there is a fear that when all this is over, a lot of people will be down with psychological trauma concerning this coronavirus. I want to know, this is taking it away from an individual, now taking it world over. How can we begin to address the psychological trauma that might come after the coronavirus?
Well, so I think it's important to state at this point that, the coronavirus pandemic is a significant, stressful life event. No one was expecting it, and no one was expecting, the magnitude and the effect that we have had so far from what we're seeing. I mean, people were not ready, nations were not ready, economies were not ready, and as such, everything appears to be crumbling before our eyes. The healthcare system, the best healthcare systems all over the world have also, crumbled. So it's not unusual to see all of these things. It's a significant stressful life event. And when significant stressful life events happen, it's important to know that people will try to cope and react in different manners. They would, respond differently. So the truth is, because of the magnitude and severity of this condition, it's not impossible that for the pandemic alone, people are going to respond. We're hearing the numbers increasing on a daily. We're hearing that the number of deaths are also increasing. It's scary. It's the reality, but it's the reality that we are faced with right now. Beyond that is the fact that, there's also the lockdown. People are beginning to live restrictive lives. People have been locked behind doors for God knows how many days. Children can't come out to play. Everyone is complaining, when will life return to normal? Then, of course, there's the uncertainty to deal with, the uncertainty of now and the possible uncertainty of the future. If you listen to the news, there's concern about, loss of jobs. There's concern about loss of finance. So there's actually, a lot going on that's it's quite worrisome. And the truth is, a lot of us may be predisposed to anxiety, we may be predisposed to stress, we may be predisposed to depression. These are not unusual things that would happen. It's also important to, look at the fact that when, a disaster like this or a significant life event like this happens, people would react either acutely, or they would react chronically. So we would have, effects that are short-term, we'll have effects that are mid-term, and we'll have effects that are long-term. For now, what we're seeing is, response to the news, people feeling, they can't sleep, they're feeling extremely stressed, they're feeling, teary, some people are unduly irritable. That's in the medium term, in the acute term. As this thing, continues or starts to get better in different countries, and hopefully by the grace of God in Nigeria, we would also continue to see, midterm effects, anxiety states. Anxiety is normal, but of course, when it starts to affect functioning and, it affects not just your own personal functioning, but your functioning at work, functioning in the community, it may then become a disorder. all the things that we would see as normal responses, such as poor sleep, undue irritability, eating problems, mild symptoms of maybe a depressive illness may then go on to become more permanent. And of course, it's important to also look at the people who already have existing physical health conditions or even mental health conditions. These are likely to get worse at this time, especially as people are unable to access care. There's a lot of social distancing going on. So, for instance, people are discouraged from coming to the hospitals except it's it's an emergency. So all of these things are likely to affect us, not just in the now, but it's also, it will be good that we start to look futuristically to the possibilities of what can happen psychologically to everyone, not just the people who are hit, not just people who are affected, even the carers, and then even people who listen to the news on a daily basis. Everyone is likely to be affected, but of course not in the same magnitude.
Imperative that we begin to look at ways of dealing with this. Like you rightly said, I know there are quite a few people that are beginning to slip into depression, and so we would like to start having advice, words of advice, how people can deal with the sudden change in lifestyle that we have been exposed to.
Well, so the truth is, this week alone, I've had calls, an increased number of calls from people who are breaking down on a daily. So it's not unusual that people will come down, like you've said, with mental health disorders, depression, anxiety problems, stress-related problems, sleep problems, eating problems, sexual problems, and even psychotic problems. I think one thing that is also interesting to note is that people are likely to start abusing substances now, what we would randomly, refer to as hard drugs. People are just trying to cope and escape from this reality. But it's important that, we face this reality squarely. It may seem like a difficult thing to ask anyone to do, but the truth is, this is everybody's reality now. So the first thing to do is to normalize the conversation. It's COVID-19. It's been in the news since. We don't know how much longer it's going to be in the news, but let us face the reality that it is here. After facing the reality that it's here, it's good to normalize the conversation that whatever it is that you feel, either whatever you feel in response to the ongoing news, either you hear that somebody you love has the condition, somebody you love has died from the condition, it's important to know that whatever it is that you feel is valid. Your concerns are valid, and the way you feel is that you're actually not alone. A lot of people may not be expressing how they feel in the same way that you are expressing it, but the truth is everybody is going through something, no matter how quiet. The thing to also do is to limit the amount of information that you get from non-credible sources. So, these days people just get a piece of information on social media, and without reading or without verifying the source of the news, they just push it out. It's also an important time for, media outlets like yours, and I must commend Silverbird Television to put out credible information and also to continue to be responsible like you have always been in your reporting. So we should also observe all precautions. If the government says stay home, let us stay home. The numbers are still rising. We're hopeful that it will get better over the next couple of weeks rather, but let's obey all precautions. Precautions as simple as washing your hands, not touching your face without washing your hands, not respiratory hygiene, sneezing or coughing into your elbow, and social distancing. These are all of the things that we should continue to observe. It's also important that if you feel overwhelmed, you can talk to someone. You can reach out to either a friend, but if it's getting more intense, more severe, and more distressing, you may want to reach out to a professional. I would like to add, however, last but not least, that people. Yes, please.
I think it's easier to drive this message to adults because they have a better maybe IQ, their intelligence quotients might be higher than that of children. I've heard some adults say that they are coughing, they feel some chest pain or some symptoms of coronavirus, and it appears that they are paranoid concerning what might be going on in their bodies. But about children, how do we explain to children the reasons why they are home, the reasons why they can't go out of the house to play? How can we send this message to them that wouldn't be depressing to them?
Well, so the truth is, it's important to also focus on these vulnerable groups. And I know that sometime last week I made a video about how to talk to children about the coronavirus pandemic. They will ask questions. They're looking at us. they're like sponges, and they're soaking us in. They're soaking in the things we say, the things that we don't say.